enlisted to help. The U.S. economy shows signs of slowing growth, a softening labor market, and elevated inflation, according to the latest data. Mike Rayleigh, NCN News.
This is Pastor Neil of the New Covenant Christian Faith Church Ministries, 5427 Murchison Road, and I am proud to be a member of Wake Up.
Welcome to Cape Fear Valley's Making Rounds Live, broadcasting and streaming live from the WIDU Community Room.
The WIDU Radio Network, WAGR in Lumberton, WYDU in Red Springs, WEWO in Laurinburg.
Making Rounds Live on 99.7 FM, 1600 AM.
We air every second and fourth Tuesday of the month.
Making Rounds Live.
The purpose of this show is to bring you information on health and wellness.
Here's the host of Making Rounds Live, Omega Jones.
Thank you so much, Ray. Welcome back to another episode of Cape Fear Valley Health's Making Rounds Live. I'm your host, Omega Jones. Today, we're diving into a topic that impacts every community. What really happens when you call 911? There's a lot of misconceptions out there, and understanding the process, it could make all the difference in an emergency. So joining us today, ladies and gentlemen, we have Ms. Sarah Bomberry with us. She is a paramedic supervisor with Cape Fear Valley Emergency Medical Services, and she's here to talk us through the general guidelines of what happens when you dial 911, what information is most important to share, the fire department, what happens when the fire department responds, and what happens when emergency medical services arrives, and then through the arrival at the emergency department itself. So she's going to walk us through that process, and she's also going to clear up an important distinction: emergent versus urgent. I have never heard the term before, but she's going to share that with us today and what those terms really mean when it comes to getting you or your loved one in the right care at the right time. So, ladies and gentlemen, I guess before we get started, let me throw this disclaimer in there. Even though I don't think we're going to talk about anything, but we're just going to cover ourselves anyway. This is a broadcast that's for informational purposes only. This is not a time for you to self-diagnose. If you find yourself suffering from anything that we may discuss today, what I want you to do is find yourself a healthcare professional. So, ladies and gentlemen, please help me welcome Ms. Sarah Bomberry. Sarah, welcome to the broadcast.
Good morning, thank you.
Let's talk about 911. Something most of us know about, but few of us really understand it. So when should someone call 911, and can you give us some clear examples of life-threatening emergencies?
So kind of same disclaimer on my end. Any comments that I make or statements are not black and white. We can't make those kind of statements. It's not safe for the community. The most obvious and definitive answer is when someone's life is threatened, whether it's their actual life is at risk, or they're in a position where they're experiencing a situation that could lead to permanent disability or serious medical situation. Some of the most obvious things that we want people to really be calling for: chest pain, stroke, shortness of breath, severe traumatic injuries, the things that I think most people would consider the obvious ones.
Now, what are some medical situations where a person shouldn't call 911? Instead of calling 911, maybe they should go to the urgent care. Mm-hmm.
Those are going to be, when you talk about the definitions between urgent and emergent, the things that need to go to an urgent care or a primary physician are flu symptoms, head cold, sinus infections, minor wounds, lower acuity type things are appropriate for urgent cares.
Ladies and gentlemen, in the studio, we have Ms. Sarah Bomberry with us. She is a paramedic supervisor with Cape Fear Valley Medical Services, and we're talking about calling 911, and she's going to walk us through the process and tell us what to expect and that type of thing today. So, Sarah, you hit on it, but I just want to make sure our listeners really get a concrete understanding. Many people, they do confuse the two, emergent versus urgent. Can you explain the difference in some simple terms to where our listeners can really grasp it?
One way you can think of it is in terms of like life or limb, for example. If your life is threatened or you're facing the potential for a severe disability, such as the loss of a limb, that is what we would consider emergent. It requires immediate intervention to prevent death or disability. And then again, the urgency is lesser acuity type things.
Do you ever hear people hesitate to call 911 because they don't want to bother responders?
Ironically, a lot of the people that do hesitate are the people that need us the most. I have seen that in my own personal experience. You can see kind of demographic differences, especially in the elderly population. They were raised differently. They were more, I think, self-reliant than a lot of folks are nowadays. And so we tend to see a lot of elderly folks that think of it that way, and they're the ones that we want you to call. It's not a bother. That's what we're here for.
All right, so what would you say to a person like that? Well, I just don't want to bother the responders. What would you say?
Bother us.
Bother
That's
us.
That's what we're here for. Even there are situations where we may come out. We may be able to resolve the situation there. We may be able to get a doctor on the phone to assist us in resolving. It doesn't always. There's such a range. It's not just we're going to throw you in the ambulance and take you to Cape Fear. We're here to help. I always tell people, if you think you should call, then call, because we're gonna show up and we're gonna help you with whatever the situation is.
Ladies and gentlemen, Miss Sarah Bomberry with us today on Cape Fear Valley Health's Making Rounds Live. Sarah, when should someone call 911? When someone calls 911, instead of hearing just a voice, who's on the other end?
The folks that work in the communication center, which we refer to as EOC, or Emergency Operations Center, have extensive training, very extensive training, and there's a group of them that work together. I think one of the biggest misunderstandings people have is that they're just talking to the single person, but in actuality there's a bank, and you may be talking to the call taker, but there's other people that are listening so that they can send out the information as it's coming in. Their goal is to be just fast, and accurate. And they work together as a really well-oiled machine to get information in and out extremely quickly.
And what is the very first thing that the operator needs to know when someone calls 911?
It sounds overly simplistic, but location should be the first thing that comes out of your mouth if you're requesting help. Children specifically, if you have children at home or relatives who may not know the street address, consider putting up a piece of mail, a post-it note on the fridge or something along those lines. People that are calling from places that are not their residence, if you're really not sure where you are, your best bet is to look for a road sign, a cross street, someone else's address. There's no reason you can't say I'm in front of this other address. Landmarks, businesses, well-known businesses, all of that information will help get us quickly to where you're at. If you are calling, and understandably people a lot of times are panicking, we can't start your way if we have to know where you're at pretty quickly. And then they're gonna come back and get more information about what's happening, but we have to know where to go.
Okay, you're talking about the information that you have to gather. You mentioned the callers, sometimes they get frustrated, but we need to know why it is so important for the caller to answer everything, even though it doesn't make any sense to them when they call at that particular time.
Yeah, I think if people get on social media and you see videos come out on the news and stuff like that, and a lot of times we hear recordings of 911 calls, and people do get extremely frustrated. They feel like it's taking too long. Why are you asking me these questions? These questions don't make sense. That's not important. That is absolutely not the case. One of the first thing that I think the public needs to know is, as the call taker is taking information in, it's going to different computer screens. We're getting the information and the dispatcher's getting the same information. So she may start, to use myself as an example, she may say EMS 200, respond to blank. They're still getting information. I'm already going. But in the time that it takes myself, the fire department, the police, or whatever resource to get there, when you keep going through those questions, that's going to get the correct resources, so that we're not sending you something you don't need, and so that we understand that if there's something different you need, like a rescue unit or animal control, we need the information to get the best response to you.
Ms. Bromberry, can you walk us through what happens the moment someone calls 911, or the moment a 911 call is made, to when emergency medical services actually arrives on the scene?
Depending on the nature of the call, and by that I mean the type of situation, whether it's a vehicle accident versus a medical emergency versus a fire, that's going to determine what kind of response you get. And by that I mean between EMS, fire department, police, the nature of the call will determine which resources are added or taken away from that call. If it's a minor medical emergency, maybe a broken bone, in a park, something along those lines, most likely you're going to get EMS. As the dispatchers and the 911 operators start adding details, as more details come in, if there's mention of a weapon, if there's mention of drug use or abuse, if there appears to be a domestic situation, that's when we're going to start adding the police response in addition. On top of that, we always have the option to request law enforcement if something about the scenario doesn't seem right or doesn't seem safe.
Yeah.
So again, why those questions are so important when you're on the phone with the operator is to get the correct resources.
All right. Now, you pretty much just hit on this, but I just want to ask it again so the listeners can understand. How do dispatchers decide whether or not to send emergency medical services, or the fire department, or the police, or a combination of all three?
So they use it's a really interesting system. It's called the EMD process. And it's kind of a card system. I don't use it myself daily, and I hope that I'm describing it accurately for my friends in dispatch, but it's a very well thought out, well planned system of codes, alphanumeric codes. It goes from, we start at 1 and we go up to 33 right now. Each of those numeric codes represents a category, such as respiratory, cardiac, injury, trauma, all these different categories. That starts the process of the call. So if I were to call and say, I'm having chest pain, that's going to start what's called a 10 card, the chest pain card. Then as the information comes in and they ask more and more questions, that's going to add an alpha value to that call, which would be Alpha, Bravo, Charlie, or Delta. Alpha being the lowest priority, and Echo would be the highest priority. Once that code is determined, that automatically triggers fire department response. So our Charlie and Delta and Echo calls will just default add the fire department. Anything below that, Bravos, Alphas, of course we can always request help, but the higher priority calls will get it automatically.
Okay. And can the severity of a call change while the responders are on the way? And if so, how does that affect the response itself?
That happens frequently. It absolutely can change, whether it gets worse or better. On the flip side of that, real quick, if people improve or something changes, you can't call back and cancel. A lot of people don't know that, and so we keep going, and then they say, well, I wanted to cancel.
Yeah.
But the other side of that, if someone's condition worsens or a situation worsens, if they're not still on the phone with 911, they can immediately call back, give the address. They're already going to know that the call exists, and it's a simple radio communication with responders. that happens real time. They pick up the radio, hey, we need you to upgrade, turn your lights and sirens on, get there faster because this has changed.
Ladies and gentlemen, our guest today, Miss Sarah Bomberry, she is the paramedic supervisor with Cape Fear Valley's Emergency Medical Services, and we're talking about 911, what happens when you call 911, what to expect, and that type of thing this morning. So, Sarah, how do dispatchers decide if an ambulance on the way to one patient gets rerouted to another case that's more urgent? How do they make that decision?
That would use the same code system that I described, the EMD system.
Yeah.
And so if we have something that's coded as a low priority, it is important to update them if the patient's condition changes, because the low priority calls can get diverted, what we refer to as diversion. During high call volume, we may be on the way to an alpha level call, and then a delta level medical call drops, and that ambulance is going to be diverted. It works with satellite tracking. The trucks have antennas, and we can actually pull our map, and you can see the little dots of everybody's location, and it pings out from the dispatch center and will locate the truck that is closest to the emergency.
Now, what happens behind the scene during those busy times that the public doesn't see? Because I know a lot of times the public will be like, why is it taking them so long? Or other responders will be, what's taking so long? So what goes on behind the scene that we really know nothing about?
There's really two factors in response to that question. Our crews are very much still involved with their patients once they arrive at the hospital. It's not a simple, come in there, show up, and drop them off. They stay with the patient. They still care for the patient while the patient is waiting on his own assignment, waiting on a room assignment. We are still responsible for those patients. So during really, really busy times, when the hospital is extremely busy, when 911 is extremely busy, it can take us a while to turn an ambulance back out from the emergency department. And on those days, these folks are not getting rest, just like the providers and the employees inside the hospital themselves. It's just go, 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 and everybody's working. I apologize, I forgot that.
Oh, it was no problem. Mainly, I just wanted to know what goes on behind the scene that the public doesn't see when it comes to 911 calls. So a lot of people, they panic, Sarah, when they call 911, and we were talking about that earlier. People are upset, they're anxious, they're excited, some are angry. So what advice do you have to help callers to keep them calm and focused during those moments?
It may sound overly simplified, but the calmer you're able to be to get the information across is going to improve the response. If we can't get information and it's an unknown situation, we can't always go right away. We need information. And it sounds silly to just say, take a deep breath. People are not going to want to hear that when they're having an emergency, and I understand that.
Yeah.
Consider the fact that if there's someone else around you that is able to be more calm, maybe there's a friend nearby or a neighbor, we'll take information from anyone. So if your loved one is hurt, which is causing you to panic, and there is someone else nearby that could take the phone from you, same result. We just want to get you what you need quickly.
All right. Ladies and gentlemen, we have Miss Sarah Bomberry with us today. She is the paramedic supervisor with Cape Fear Valley Health's Emergency Medical Services, learning everything about 911 today. And if you have a question, what you can do is give us a call at 910-483-6111. Again, 910-483-6111. Miss Glenda will answer the phone. She'll make sure we get the question. And if you're following our live feed by way of Facebook, leave the question in the comment section, and Lindsay will make sure that we get the question answered if Lindsay can already answer the question herself. But our guest today is Miss Sarah Bomberry, today on Cape Fear Valley Health's Making Rounds Live. Ms. Bomberry, what are some of the most important details that we should try to give when we call 911? We know about location. You've already mentioned that. Is there anything else other than location that we need to try to give them?
If the situation involves any special circumstances, that's important for us to know. If we have an access issue, as in this person is in an unreachable area, do we need, the Cape Fear River Trail is a good example. If somebody has an emergency while walking or biking on that trail, that's important to know whether they're mobile or not, because we have an ATV that will actually the fire department does, to help get that person out. Some people have specialty medical equipment that it's good to be aware of beforehand while we're on the way there. And some people have physical limitations that we need to account for, whether it's a bariatric patient or a handicapped patient that has access needs.
Okay. Let's talk about preparing in advance. Is there anything that families can do in advance to prepare for an emergency? You did mention earlier about putting an envelope with the address on it. What about if we have medications, and what if we have small children? Is there anything that we need to do involving the medication or maybe small children?
The medication lists are a gift to medical providers. We love a medication list. It saves a lot of time. A lot of us will just snap a picture of a medication list. That is always an absolutely fantastic idea. If you have an extensive medical history, I suggest carrying one with you even. And in the case where you might have, someone might be unconscious, that's something we could still access and know what we're looking at a lot faster than having to try to figure it out. We do encounter scenes quite a bit where we have to account for small children when an adult is injured. We have a number of ways of dealing with that. We won't ever leave, children or minors unattended. If a caller is able to, if it's feasible with the circumstances, they should attempt to make contact as soon as possible with a family member or a friend that can come help with the kids. If that's not possible, we understand it happens. We're going to get the kids taken care of, whether we take them with us or law enforcement will assist us with that.
Is there anything that we can do to make our homes easier access for emergency medical services, like maybe remove pets, maybe lock, if we have pets, or lock doors, or special circumstances? What can we do on our end to make it easier for emergency medical services?
The biggest and most primary thing is your house numbers being visible. This is a very detrimental issue, especially at nighttime for night crews. If you've seen those green kind of iridescent address signs, those are really the ultimate fix for your house. But the house and the mailbox, preferably, if it's clearly labeled with your house number, we're going to find you a lot faster.
Okay.
And then, obvious obstructions that would prevent us from getting inside the door, up on the porch, up a ramp, stuff like that. And understandably, there's times where there's just nothing that this person can do. We're going to figure out a way around it. We're still going to come help. We have tools, we have ways of working through this stuff. But if you have the opportunity to prepare, then it's helpful. Unlock the door, clear the ramp, stuff like that, yeah.
How do responders prepare? How do you all prepare when you know that there may be weapons in the home, or if you're coming up on a difficult access issue? How do you all handle that?
It depends on the specific issue. If we know that there's a scene where weapons are present or involved, an assault scene, domestic violence incident, something like that, we're actually going to wait what's called staging for police response, for law enforcement response. And that's very simply, whether they scoot past us on the way to the call or they beat us there, and then we're going to wait until they radio us and tell us what they call scene is safe.
Okay.
Go ahead and come in, and now we can treat the medical issue.
Okay.
I would ask that patients going to Cape Fear, or any hospital really, if you have pocket knives, a lot of people do carry firearms, and that's fine. We can't bring those to the hospital with us. We don't want them in the ambulance, and they're not going to be accepted into the hospital. So again, depending on the type of emergency, we don't expect people to have everything completely organized, but just something to keep in mind if you have the opportunity to correct that beforehand.
Now, once emergency medical services arrive, what can patients and families expect to happen first?
We're going to make contact with the patient, identify the patient, and make contact with the patient and start what's called an assessment. We are really starting that before we even meet the patient. We have information from the call notes that's already going to give us an idea of what we're looking for, what we need to be thinking about. And as we're approaching you, even if as I'm approaching you from across the room, I'm looking at the way you're breathing, your body positioning, your skin color. Is it extremely pale? Is it extremely red? So we will perform an assessment, and we do that very quickly. Depending on the urgency of the situation, that's when we're going to make our first initial decision to say, hey, we need to hurry up on this one. Or we can stay in the living room and take a few more minutes and check a couple of things out.
All right. Sarah, we have a call. We have a question. Mac on line 2. How are you, Mac?
I'm good. How are you?
Doing fine. What's your question?
I had two, actually, and I hear a lot about calling the rescue squad. Is that different from EMS, or is that just a different moniker, I guess?
He said that the calling EMS and calling, what was it? Calling the rescue squad.
Rescue squad?
And EMS. Well, is it the difference, or is it basically the same?
It depends on the community. Here in Cumberland County, it's all going to route to the Emergency Operations Center, and they're all in the same area together. So they're going to sort from there which response. I know in some outlying counties, especially with volunteer departments, people do still call what he's referring to like the rescue squad on its own. In Cumberland County specifically, I really can't speak to another specific system, but I know in Cumberland, it's all lumped together, and it's going to be determined based on the call.
Okay. All right. And Mac, you had another question?
Okay, and then last one, Sarah, if there was one thing that you wanted just kind of us regular people of Cumberland to know about EMS, what would that be?
Pull to the right and stop. It's safer for everybody. Don't panic and slam on your brakes if we come up behind you, please. If everybody just reach back to their driver's ed training and pull to the right and stop. We're trying to be careful. We want everybody to be careful out there. And it can get pretty comical on the roads out here.
Oh, I can only imagine. All right, Mac, did you have another question before we go?
No, I'm good. Thank you so much.
Well, thank you for
what you
calling.
do.
All right. And ladies and gentlemen, once again, we have Miss Sarah Bomberry. She's with us today on Cape Fear Valley Health's Making Rounds Live. And just like Mac, if you have a question you want answered, you can give us a call, 910-483-6111. Again, 910-483-6111. Or if you're following us by way of the live feed, you can leave the question in the comment section, and Lindsay will get that question answered for you today. So Sarah, how do you balance reassuring families with quickly treating the patient? That is a fine line. So how do you balance that?
For me personally, I think about what I would need in that moment, and the answer to that is information. So as much as I'm able to, I provide information while simultaneously working. So especially with an unconscious patient or a very serious situation, it's well worth it for the benefit of family members or bystanders or friends to just say, as you're moving this patient, as you're doing things, I'm doing this because, hey, we're getting ready to do this. We're going to put them on the stretcher, and then we're going to do this. Just to give that person some idea that, this is what's happening next. A lot of people, it's just fear and apprehension in so many of these situations. And if you can just share a little bit of information about what's going on, don't be cryptic. I learned many years ago in my career, nobody wants to tell someone, oh, you're having a heart attack. Nobody wants to hear it, and it can sometimes be really difficult conversations.
Yeah.
And the same applies for family members. But it makes a big difference if you just say it and then proceed with the information. You're having a heart attack, but here's what we're going to do.
Okay. Now, how can you explain emergency medical service? Well, let me rephrase this. Can you explain how emergency medical services coordinates with the emergency department once the patient is en route? Because I don't know if you're old enough to remember the show Emergency, but that's exactly where my mind went. So give us a picture.
It's literally via radio.
Okay.
Yeah. So we switch to the Cape Fear Valley channel, and we call in a radio report, which is kind of basic information, vital signs, how we're coming in. Are we coming in code? We determine. It's kind of a system of language that we use between us and the emergency department, so that they know what we're bringing: a code stroke, a trauma red, et cetera, et cetera. And we do that via radio.
Okay. Ladies and gentlemen, in the studio, we have Miss Sarah Bomberry with us today. She is the emergency, hold on, let me make sure I get the title right. She is the paramedic supervisor. I was getting ready to give her a promotion. She is the paramedic supervisor with Cape Fear Valley's Emergency Medical Services. And Sarah, we have another question. We have a caller on line 1. Miss Carey, good afternoon.
Good afternoon. How are you?
I am fine. Thank you so much for listening. You have a question for us?
I do. I heard you talking about the Cumberland EMS. You all are only allowed to go from wherever you are to Cape Fear Valley. They're not allowed to go like to First Health, the EMS team.
Okay, did you hear the question?
I heard it, yeah.
Okay.
No, we are allowed to.
Okay.
Yeah, you don't have to go to Cape Fear Valley. We frequently go to First Health Hoke, the new one up on Rayford Road, which is not far apart from Cape Fear Valley Hoke. Bessie Johnson is our frequent destination. Really, we're surrounded by a lot of Cape Fear Valley facilities. What we're not able to do frequently is leave the county, and we can't do that because it takes us too long to get back. But people do have choices. When it's appropriate, we do ask what your choice is. In some cases, we make the choice for you based on what's available at specific hospitals. If you're having a very serious emergency that requires a surgeon, the cath lab, stuff like that, it wouldn't be right or feasible for us to take you to First Health Hope, knowing that they don't have those options.
Okay. All right. Miss Carey, did she answer your question?
Yeah, but I have a little extra to say in connection with that. Because the reason I asked this question was because a friend of mine, she was a little ill and needed to go for some care, and she requested going to First Health, and the attendants refused to take her. They told her they're not allowed to go there to First Health in Hope. And they said the only thing they would do for her would assess her, and then she would have to go by car because the ambulance wouldn't take her.
Yes, ma'am, I can explain that. That's a separate issue. Sometimes hospitals, when they reach a certain capacity, go on what's called diversion, specifically out-of-county diversion. So, for example, if First Health Hoke reaches what they consider capacity, we can't take any more patients, we don't have room, they will notify our emergency operations center that we're on out-of-county diversion. And what that means for us is it goes as a note in all of our computers, so that when a patient requests a different hospital, we do have to check. And if the hospital is on diversion, they can divert an ambulance from coming there, but not someone in a vehicle. So that may explain what your friend experienced on that particular incident. It was most likely that the hospital was on diversion.
All right. Ms. Carey, do you have any other questions?
Okay, I'm still talking about that same incident.
Yes, ma'am.
They refused to take her. They said she could only go to Cape Fear Valley. So you can go by Carson, but we can't take you there. We have to only take you to Cape Fear Valley. And they assessed her, and that was the end of it. And I saw that happen twice.
Yes, ma'am.
It wasn't like they talked to nobody. They just said we're not allowed to go there. That was their answer. But when she went, the attendant at First Health said that they could have come and brought her there because there was no reason for them not to. And I just couldn't quite understand that.
Okay. All right.
I'd have to look at that specific case.
Okay. She said she would have to look at the specifics on that one, Ms. Carey.
Okay. All right.
All right.
I saw it happen many times, and I was just, I thought that was kind of bad, but it did happen,
Yes, ma'am.
And then I'm like, well, you can't go, you can't depend on them to take you where you want to go.
Yes, ma'am. All right. Well, like I said, Ms. Carey, thank you so much for your question, and thank you for calling. All right. Ladies and gentlemen, in the studio, we have Miss Sarah Bomberry with us today. She is with Cape Fear Valley's Emergency Medical Services. She is a paramedic supervisor with Cape Fear Valley's Medical Emergency Services. And one question, Sarah, since emergency medical services, you guys carry blood. Does this mean you guys can perform transfusions en route?
Yes, specifically regarding trauma patients.
Okay.
Not medical blood transfusions. That was a development or an accomplishment we've reached just in the last few years. I wish I had looked up the exact time frame to tell you, but that's fairly new. We have 4 QRVs in the county, which stands for Quick Response Vehicle, which is a Chevy Tahoe with an advanced level called a lead paramedic or a supervisor, that has pretty much the same equipment that an ambulance has, but does not have the ability to transport. Those vehicles are dispatched to with an ambulance in high severity traumatic calls, and those 4 vehicles have a unit of blood each.
Okay.
With the blood warmer, and we've all had additional training from Dr. Matt Wells on how and when and why to administer the blood. We have used it quite a few times in the field in traumatic injuries.
And Sarah, I know someone is going to ask this question, so let me just go ahead and put it out there. Why does it sometimes feel like it's taking so long for an ambulance to arrive?
It's busy. It's busy. The call volume, what we refer to as call volume, sometimes can be very unpredictable. We may go from having 6 ambulances available for use, and in a matter of 10 minutes, we've run out. It's just unpredictable. We have a whole series of processes that try to, get everything back available as quickly as we can, where they need to be as quickly as they can. But just like anything else, sometimes we just get overrun, and it takes a while. And if you are one of the lower priority codes, for example, we talked early on about like head cold symptoms, sinus infection. If that's the presenting problem, there is a high likelihood during those busy times that you're going to get, you're going to end up at the bottom of that list, unfortunately.
Now, are there any times when let's talk about the myths. One of the biggest myths, and I remember, and I'm guilty of doing this years ago myself, Sarah, because it was out there that if you arrive to the hospital by ambulance, you get seen faster. Now, can you clear that up for us?
Emphatically, no, not true. That is probably the biggest myth involving 911 and the use of ambulances. And it's not even been a week or two since we've had the last person that walks out of Cape Fear Valley's ED and goes about a block or two away and calls 911. It's absolutely not true. Everybody that arrives at the hospital, despite how you arrive, bus, car, ambulance, everybody gets triaged appropriately and the same.
I apologize about that. I thought I had turned my phone off earlier. I do apologize. Okay, now, what are some of the biggest misconceptions or myths about EMS that you wish people understood better?
Well, you probably hit on the biggest right there.
Okay.
Let's see, popular myths. We don't always use license sirens. A lot of people ask, like, why aren't you turning the lights on? Why aren't you turning the sirens on? The answer to that is because it increases the danger. It increases the risk for accidents for us and the people around us. We are going to use lights and sirens as infrequently as possible to keep everybody safer. If we've got lights and sirens on, we either haven't gotten there yet or it's bad, and we really need you to, like I said, pull to the right and stop.
Yeah.
We try not to do that a lot. Let's see. The straight to the room is really the biggest kicker there. None are coming to mind immediately.
You'll think of a whole bunch of them later on after the broadcast.
I would. There, one thing that we see quite a bit, and this actually will affect future responses if it's tagged to this address.
Mm-hmm.
These people that are responding to you are, this is their career. They're making a living. They're good people, and they're coming to help you. And you can't treat them the way that they get treated sometimes.
Yeah.
It's not okay to hit them. It's not okay to cuss at them. It's just not acceptable. The same rules apply to us that apply to the patients inside and the staff inside the hospital.
Yeah. Now, before we close out, actually 2 questions. One just came to mind. If you have someone, because the reason why I'm asking this is that I didn't listen to the EMS when they told me this. Following the EMS to the hospital, she told me, we are taking your husband to the hospital, but you have to follow the laws. You have to follow the rules of the road. I didn't do that, Sarah. When the EMS ran the red light, I ran the red light. When the EMS went up on the sidewalk, I went up on the sidewalk. Tell everyone why you should not do what I did.
Well, because you're going to get in an accident, Omega. Interesting fact, I should have mentioned this. We also have to follow all traffic laws, regardless of whether we have our lights and sirens on. And you should see, even if you see an ambulance approaching an intersection with a stoplight, they do still have to come to a complete stop, even with all the noise and the flashing lights. But no, our biggest concern about following, especially for someone who's nervous and anxious and worried about their loved one, is that you're not going to be paying attention. People are going to look for the ambulance maybe and see, and then they're going to go, okay, the ambulance made it through. Well, they're not expecting you to come, and they might decide to go ahead and go, and then you've caused yourself a second problem.
Yeah.
Well,
one final question before you go. If you could give one golden rule to our listeners and our viewers for when and how to call 911, what would that be?
The golden rule.
Yes, the number one rule.
I gotta say, if you need us, call us.
If you need us, call us.
We're coming. We're gonna figure something out.
All right. Well, ladies and gentlemen, we have had the honor to talk with Miss Sarah Bomberry today. She is the paramedic supervisor with Cape Fear Valley's Emergency Medical Services. Oh, and one other question before we go. What is the one thing, I know I've already said about the one golden rule, but what is the one thing that you want to stress to our listeners and our viewers regarding making those 911 calls, or maybe EMS, or even following EMS? since I put myself out there like that. So what is the number one thing that you want to, the number one message you want to get across to our listeners and our viewers today?
We want to help. The people that are in these jobs are doing it because they want to help. Be kind to each other. Be kind to each other before we get there, on accident scenes and stuff like that. These are good people that work for us and that are in this job, and we're here to help. We want to help, and everybody needs to be nice.
Well, ladies and gentlemen, Miss Sarah Bomberry, she is the paramedic supervisor with Cape Fear Valley's EMS. Sarah, thank you so much for taking time out of your schedule to talk with us today, to inform us about 911, because I've learned a lot today. Thank you so much.
Thank you.
And ladies and gentlemen, make sure you join us again on Tuesday, September 23rd. We will be talking about the upcoming Flourish event. And for our producers, Shaka Jordan, Lindsey Graham, and Ray Thomas, and the hardworking team behind the scene, I'm Omega Jones, continuing the legacy of Darvin Jones. Thank you so much for watching and listening to Cape Fear Valley Health's Making Rounds Live.
It's your